Over the last decade, despite the efforts of many, the rate of suicide for Arizona veterans has been more than double the general population. While historically suicide prevention efforts have focused primarily on crisis intervention, Arizona took the first steps to add an upstream prevention approach by establishing the Be Connected program. When any service member, veteran, or family member or helper reaches out with a need, we respond and provide support, navigation, and resource connection. This responsive approach is essential, but what if we didn't have to wait for someone to reach out or be in crisis? What if we could identify those at higher risk and proactively reach out to them so they know that Be Connected is here for them now and into the future? The Be Connected risk reduction strategy is built on this proactive approach. With support from the CDC, we created tools to identify those at greater risk due to factors such as age, geographic location, disability status, and more. With this information, we develop evidence-informed approaches to reach, engage, support, and connect service members, veterans, and their families. For example, ensuring veterans who are filing disability claims are aware of other resources available to address their social determinants of health, and connecting transitioning service members coming to Arizona with community support. How do we measure our success with this approach? A change in suicide rates is a long-term measure, often taking several years to yield a difference. So how do we know what we are doing today has the intended impact on the future? The Be Connected risk reduction strategy uses short and intermediate outcomes as measures for reducing suicide risk. The theory is that by reducing suicide risk in the lives of individual veterans, over time we can reduce the rates of suicide across the entire population. These outcome measures for reducing suicide risk include increased access to care, increased access to support, improvements in social determinants of health, and increased social connectedness. Our collective goal is strong crisis response and upstream prevention with an evidence-informed comprehensive risk reduction strategy. Suicide is a complex issue with no simple solutions. This multifaceted approach is how we can work together proactively to reduce risk for our veterans and eliminate disparities in veteran suicide. Join us in being part of the solution.